So I'm glad you joined us today for how to recognize suicide risk in our patients and coworkers. And because this is an emotional topic, I want to offer a trigger warning and then also bring your attention to the fact that you can download the PDF at any time to follow along using that QR code. I was sitting in the back of this police car in a parking lot when the policeman turned around and said, "We found your son dead this morning." And he told us it was a suicide and the method left no question. My son Charles is the funniest and most popular kid in school. Yet the funniest and most popular kid in school suffered from depression, became addicted to heroin, and killed himself in 2015. I didn't think my son was the type. He certainly didn't look or act the type. And it was both shocking and absolutely the most difficult tragedy I've ever endured. This is a happy mama moment, though. This is a picture of him on homecoming court his sophomore year being escorted by his favorite teacher, Miss Fretwell. And of course, he's making her laugh. But it wasn't long after this picture was taken that Charles's drug use started to escalate. And I didn't know why, but I would find out later that my son was struggling with thoughts of suicide. And drugs and alcohol were an antidote to help him manage his pain, his sleep, and his thoughts of suicide. What I also didn't know is that anybody who misuses just alcohol is 10 times more likely to die by suicide. In fact, none of the mental health professionals even discussed suicidality as a possibility, although the tests he took certainly pointed to that. So his drug and alcohol use goes up to a point that I think he's very cavalier about life, and I'm like worried that he's going to die. And we had used all the resources locally, and so his father and I, with counsel who told us this was a good idea, to have him kidnapped out of his bed and taken to a wilderness program. Basically, therapy and being far away from drugs is sort of what it's all about. This is where we would finally get a diagnosis, and it was depression, anxiety, ADHD combined type, and something I'd never heard of, which was called cannabis dependence. And that meant he was using marijuana basically to manage his everyday issues. The trouble with that is when kids under 25 abuse that, it can actually trigger schizophrenia, psychosis, cause permanent brain damage. And it can also make them violent and irritable and angry. And we often think of marijuana as a chill drug, but it doesn't have that effect on a lot of people. With Charles, it kind of made him irritable. It definitely made his anxiety worse. And he did have periods of psychosis as a result of using marijuana. So obviously he wasn't real happy about being kidnapped out of his bed and plopped in the woods in the middle of April. And we weren't real excited to have to take that step. And what was recommended for the next step is a therapeutic boarding school. That wasn't plan A either. That's not exactly something you do because you've caught your kid with a beer and a joint. All those steps are things that you do as a desperate parent because you can't see any other way. He would come home in 2014 having spent some 22 months outside our home in some kind of placement. And what I didn't know is that Charles would right away go back to using drugs and alcohol to manage his thoughts of suicide, which I still don't know about at this point. And he would eventually become addicted to heroin. He would go to detox. He would go to rehab. And then he would land in a recovery house. And he would relapse at the recovery house. Now, it was their protocol at the recovery house to take him to the hospital for full workup. And they took him to the hospital, but they didn't do a suicide risk assessment. And they asked for it, and they sent him to the psychiatric hospital for that to be done. And when they got to the psych hospital, they refused to do it because they didn't take those people anymore, meaning people who were addicted to heroin. And that made my son feel like pure garbage. So in the 2 weeks prior to his death, my son was at the doctor one time, at a hospital another, and a psych hospital. And at none of those 3 times was he given a suicide risk evaluation, despite signs of suicidality. I'm not blaming the hospital system because I certainly missed a lot of opportunities, but I really do feel like regular screening is worth it to save people from this fate. I'm struggling. I'm a mom who's grieving, and I decided to tell my story, and I was absolutely terrified to do so. But I put it out there, and my biggest fear is that no one would read it and that I would feel like I was burying my son's memory all over again. But what happened is it went viral because other people were reading their story in mine. So I want to briefly talk about mental health. So when we're looking for despair within our patients or within our coworkers, we're sort of trained to look for this sort of scenario, right? But that's what we see only a small percentage of the time. Sometimes we see despair and depression expressed as anger or irritability, and at times we can even take that personally. But oftentimes, if we kind of soften and look at that person and say, do you need to talk? It can really go a long way. Another sign that somebody might be struggling is isolating or ghosting us. And again, we take that personally. We think it has something to do with us when really it has to do with that particular person and how they're feeling. This is what I saw. Happy-go-lucky, constant revolving door of friends. So the face of suicide doesn't ever look like one particular thing, and it can be that it looks happy-go-lucky because people wear the mask of a clown because they're afraid. They don't want people to know because they fear about what you will think of them. So we're going to take a closer look at suicide. Some of the risk factors include having a mental health issue, depression, bipolar, something like that, chronic pain, TBI, serious health issues, or a past trauma. And then there are things that are happening in people's current psychosocial world, like a divorce or moving from one place to another. And what I want you to know is nobody dies by suicide because they're getting a divorce or because they're bullied. It's never one thing. Those are contributing factors because suicidality is a constellation of things that converge all at once, usually having to do with health, history, and environment, biological and psychological aspects of a person's health. Historical factors are things that happen in the person's family, past history, and environmental factors, including society and cultural things, access to lethal means, as well as those individual life events. I want you to know that talking about suicide does not give people the idea. And suicide is a public health issue, not a crime. So we don't want to use committed. It's died by suicide, killed himself, or suicided as a verb. So people who are suicidal, they ghost and isolate, they behave recklessly, they do a lot of drinking and drugging, they'll fall asleep at work, maybe there's a drop in performance. My son was a frequent flyer to the doctor or the school nurse often. giving things away like prized possessions and behavior changes. So it's not one of these things or all of these things. So, for example, my son had about 6 of these on the list. And so it is usually more than one, but your gut really knows when something is the matter. What I didn't know, what a lot of other people don't know, is that those who are struggling with thoughts of suicide want to tell. And they'll say things like, I want to die. I feel so worthless. I feel so numb. I'm such a burden. I can't do this anymore. So to sort of show you what it looks like on social media, if I died, no one would notice for at least a month. And by the way, these are my son's last tweets that I didn't see because I was blocked from his social media. If you want to see who really cares about you, see who's there when you have nothing. Death sounds nice. What did people think? They thought he was kidding. And 3 days later, he would take his life. So what do you say when you suspect that somebody is struggling with suicide? And it's really not what you say, it's how you intervene. And you need to intervene with empathy and compassion. And you can really stop suicide with your ears. You don't have to fix this. That's not your job. You can't fix it. So how do you listen? The most important thing is to allow the person to feel heard. Meet them where they are and listen with curiosity and empathy. And then you have to ask the question, are you thinking of suicide, or are you thinking of killing yourself? You have to ask directly. That's the only way you find out if somebody is thinking about suicide. This is a screening tool from the National Institute of Mental Health. It is free, and you can download this, and it has 4 questions. If they answer yes to any of those 4, you ask the 5th one. And they have a toolkit with protocols and pathways. You want to avoid minimizing feelings, convincing them life is worth living, or trying to fix it. Here's some example sound bites of what you would say. Tell me more about how you feel. I'm listening. And then you be quiet. And you don't want to say you have so much to live for, because that's not meeting the person where they are right now. They're at a place of despair, and that's where you have to meet them. You want to say, I'm so grateful you shared this with me. I know it was hard, because they opened up themselves to you. You don't want to be that toxic positivity cheerleader with, you got this, you got to stop talking like that. You want to say, I'm unsure of next step, but we'll figure this out together, okay? You don't have to be an expert, that's okay. You just want to show that partnership. And you don't want to try to extract a promise, because if you say promise you won't attempt suicide, that's not something they can promise. Trust your gut. Seriously, your brain will try to talk you out of this, and then you'll feel this sense of fear and you'll step back. But I want you to work through that fear. I want you to trust your gut. Don't let your brain talk you out of it. Engage in private conversation. Listen with empathy without fixing, and connect that person with help. Help can be in the form of a loved one or relative that can sit with that person and remove a firearm if there's one in the house, or any other type of ways they may kill themselves. You can call a local crisis number together, the Suicide Prevention Lifeline. You can drive them to a hospital. 911 is kind of a last resort, and a lot of people think that's the default, but it's really not. Crisis text line is another option. The antidote to suicide is connection. And the more you reach out and connect with people, the more you're creating a foundation of suicide prevention. I want you to know, as funny and as talented as my son was, his greatest gift was letting other people know that they matter. And That's something that each and every one of us is capable of doing starting today. Just want to let you know of some free resources that I have online. And then if you download the PDF, I also have links to different articles. I want to thank you today for allowing me to give you a quick overview of suicide prevention and healthcare.